to the child. We've sequestered all of our equipment off over here. We've maintained the view to the outside. We've allowed a provider workspace over here with a computer on a mobile cart.
A thought revolution is beginning to sweep through American healthcare organizations. Healthcare administrators and physician leaders are using lean manufacturing strategy to improve quality, cost, and response time by removing waste. A relentless pursuit of waste is creating healthcare organization cultures of never-ending improvement. This better ensures that the resources society expends on healthcare is best serving healthcare customers, patients, and their loved ones. Every aspect of healthcare can be analyzed for waste and improved. At Joan, Wellman and Associates, we extend that improvement into the design of healthcare facilities.
For us to think about lean in big ways, or how we take our process and apply the Toyota principles to a big building full of complex processes. The challenge of the process here is not only to think what works for us, but how do we change how we work. And this is where it takes it from just a simple project of designing a building to thinking in an innovative way to change the way we work as we do a new building.
How do we design a lean facility? We use a series of workshops we call Rapid Process Design for Facilities. The objective of the workshops is to A, design a facility ready for lean operations, and B, partner with architects, contractors, project managers, and the healthcare client to deliver the project in less time with less waste than traditional projects. The first phase is governance. This ensures that the client's strategic plan, programming, and assumptions are clear and identify lean principles that will guide the project. Phase 1 ends when a clear charter has been signed by those in charge and a core team of end users is identified to stay with the project from beginning to end. The second phase is the assessment of the current state and space programming. Analysis of current facilities deepens knowledge of lean principles and initiates the practice of applying lean principles directly to the workplace. Participants learn lean principles such as continuous flow processing, standard work, and mistake proofing. The team now knows what to look for when designing the new facility and can wisely customize the design based on current and future demand. The third phase, conceptual design, results in schematic drawings for each area. All options are explored, resulting in many different plans. One of these will carry through to the next phase, where it will be tested by end users. The fourth phase tests the work of the previous phases. End users, including patients, families, and staff, evaluate the high-level layout. The evaluation involves testing all 7 healthcare flows on the floor plan. The 7 healthcare flows are patient, family, provider, supplies, medicine, equipment, and information. Is the distance that patients have to travel reduced? Is there a line of sight for staff working in the area? Are there safety considerations for the layout that have not been explored? The team is now ready for detailed design. All right, let's go 3D. In the final phase, the team builds a 3-dimensional model of the design and positions equipment, supplies, and furniture in their model. Once the mock-up is complete, end users simulate tasks using an array of scenarios. For each design, the team physically moves through each of the 7 healthcare flows. Additional end users are brought in and a survey of observations is taken. The team then responds to the feedback with new configurations of the model. The process of evaluation and improvement continues relentlessly, in an environment where every last detail can be readily taken into account. Soon we will arrive at the optimal model, finalized with details down to the placement of every coat hanger and electrical outlet.
Is this out of familiarity or truly utility?
This is truly utility.
Okay.
The mock-ups, I think, are the most important part of the process, actually, because what it shows us is that while the design may work on paper, until we're there actually pushing the carts around physically around the boxes and stuff, we sometimes have to change our design because it simply doesn't work. It also allows us to feel the space, and we can right size then based on whether the space is too big or too small. Door placement is a big one, line of sight issues, kind of getting things to align. Size of our equipment, it's pushed us into thinking, can we actually minimize the size of equipment as an issue? How can we think smaller? Is there smaller equipment out there?
Are rapid process design workshops all that it takes to succeed? No. In order for the process to work, our values must promote engagement, persistence, collaboration, and open-mindedness. A truly lean facility can only come from the deepest commitment to the constant improvement of healthcare.
The chance to have an idea and to see it and think of it and then to try it out and find out if it works. And when you have a bunch of people cross-pollinating that creativity, it feeds on itself.